Hi, I'm Dr. Ayyappan Nair. I'm a shoulder surgeon at Manipal Hospital, Whitefield, Bangalore, India. And today I'll be speaking on the PASTA lesions. PASTA stands for partial articular surface supraspinatus tendon avulsion or tendon injury. So they are basically injuries of the rotator cuff. So the rotator cuff would have is a group of muscles which is composed of the subscapularis in the front of the shoulder, like this. Subscapularis in the front, supraspinatus on top, infraspinatus, and the teres minor. So now the supraspinatus or even the subscap or the infraspinatus, anything could be partially torn. So these are called partial tears. The tear could be either from the joint side, that is from inside, or from the outside. These inside tears are called as articular surface tears or PASTA lesions. Now coming to the incidence, it's quite common and you can find it in 15% of MRIs, 17% ultrasonic studies, and 18% in cadavers. They're much more common on the articular surface, that is PASTA lesions, they're much more common than bursal side lesions. The different classifications. So classification help us to understand what is the thickness of the tear, what is the extent of the tear, and all that, and it also helps in the treatment. When you come to the PASTA, the most important anatomical consideration should be the thickness of the footprint, or how much is the muscle attachment onto the bone, as seen in this particular picture. So here we can see that the medial lateral, that means the attachment from on the pink side here, the supraspinatus would be around 7 mm or 6.9 mm. Why is the PASTA important? Because it progresses. If it's a small tear or a partial tear, you can progress to full tear, and a full tear can cause you more problems like pseudoparalysis and even lifting of the shoulder. So what is the importance of more than 50% thickness tears? So progression basically means a partial tear progress to full tear, and if you look at the data, we can find that this JBJS papers which tells us that 44% of partial tears progress to full tears over a period of 5 years. 33% of the asymptomatic tears become symptomatic over a period of 2 years. 40% of symptomatic partial rotator cuff tears progress to full tears when you do ultrasonic studies. Now question is, what is important of this 50% thickness? If a tear is more than 50% thickness, then they have higher rate of progression. That means they progress on a very fast progress on a higher rate. That means 55% of high grade partial tears, that is more than 50% thickness, exhibited progression. At the same time, only 14% of low grade means less than 50% thickness partial tears progress. That means more than 50% thickness tears have higher chance of becoming full tears and faster, and that's why they have to be dealt with or operated or treated. So again, articles showing the progression of these partial tears into full tears. So when you look at my consideration, so what are the things I look at in my patients to help them if they have partial tears? So if it is, I look like if the patient has got less than 50% thickness tear or more than 50% thickness tear. The tear is torn, that is if the partial tear more than half torn of the muscle if it is fully torn. Next is if it is traumatic or degenerative. So trauma, because there's a reason for each, because now 50% thickness, I just told you now, if it is less than 50% thickness tear, less chance of progression, more than 50% thickness tear, higher chance of progression. Traumatic tears have a higher healing potential than degenerative tears. So again, I see if it is traumatic or degenerative. Next, coming to if the tear is symptomatic or asymptomatic. If it is asymptomatic, you need not operate, you can leave it alone. But definitely in the symptomatic tears, you have to take care of it. So what are the treatment options in front of us? Suppose it's a traumatic tear. Then how do I take it forward? Suppose it's a traumatic tear, less than 50% thickness. Then in my patients, I have a series where we have great results with PRP injection. So we have excellent return to full power function, and we also have studies, ultrasound studies showing that there's definitely a reduction, and even MRIs showing a reduction in the tear width and the tear thickness over a period of 6 weeks. When we give you a PRP injection. So PRP works very well with me in traumatic tears less than 50% thickness. At the same time, if it's a degenerative tear, degeneration is always associated with some problem in mechanics. The patient could be having frozen shoulder, impingement, capsular tightness, internal impingement, protraction, So in those kind of cases, we have to correct that by therapy, rehab, steroid shots, and definitely I would not again operate on these patients. But again, they do very well with correction of the mechanics. Coming to PRP injections, when you look at meta-analysis, systematic reviews, large-scale studies, they show that they got mixed results. But in my hands, traumatic tears less than 50% thickness have great results with the PRP shot.
Yeah.
Coming to steroids, I definitely use steroids in degenerative tears, less than 50% thickness, patients who don't want surgeries. And so it is very important that we choose what kind of steroid. Normally use betamethasone. I use it silocaine, lidocaine. Then coming to role of arthroscopy. So we have different arthroscopic treatment methods. In my practice, I don't do arthroscopic debridement because I have excellent results with conservative management. Even though literature shows that there's excellent results, I don't use it because I feel it is not required in my patients. So I don't use arthroscopic debridement as a technique in patients who have less than 50% thickness tears. Coming to more than 50% thickness tears, the surgical techniques would be, so here we have two choices. Either we do a trans tendon, that means I put a small incision in the tendon, pass the anchor into the tendon, and then suture up the tendon. This is called as trans tendon. The other technique called takedown. Takedown basically means we have to remove the remaining attached portion of the rotator cuff, and the entire rotator cuff is made like a full thickness rotator cuff tab, and we suture it up. So this is a video of the takedown technique where I've completely taken down the partial rotator cuff. You can see there's a partial rotator cuff there, and so I'm preparing the bed. And compare it like a full thickness rotator cuff tear. So when you look at results of surgical takedown, and both are comparable, both results are pretty good. So partial tear, if you do a takedown technique or a trans-tendon technique, you almost got the same kind of results. This is a trans-tendon technique. So here in trans-tendon technique, what we do is we maintain we retain the remaining the cuff attachment. We don't take the remaining part of the cuff from the footprint, and we pass the anchors through the cuff and repair it up. And I use a particular technique using fiber tapes. These are the results of a trans-tendon technique. Again, trans-tendon techniques have excellent results. It shows excellent healing patterns. Again, these are more results showing excellent outcomes with the trans-tendon technique as well. So to sum it up, there's no difference in outcomes which are reported in conversion as well as in situ repairs in more than 50% thickness. They have got excellent results. Coming to biologics, I've already mentioned the PRP. PRP is excellent, it's good, but mainly are used in less than 50% thickness tests. Stem cells, so again, it's supposed to be good. They showed improved scores, but we don't have any long-term results. So another recent technique which has been used is the collagen patches. So collagen patches are, so we put a collagen patch and stitch it up with staples, specialized staples on top of a partially torn rotator cuff. So, and whatever the gapping is there completely heals up, as in this particular picture. Again, excellent results. Thank you so much. So I hope I have made a point here. So the takeaway point would be like, if it is less than 50% thickness tears, definitely got great results conservatively. More than 50% because they progress. It is better to operate with different types of techniques, and all techniques have got the same kind of results. The PRP and the other biologics and stem cells also play a very important role. So hope you had good time listening. Thank you.